This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more. Yep, looks good.
Cool. Welcome, everyone. I'm Chris. I'm one of the chiefs at VCU PM&R department. Glad to have you all here. We are excited to have you. This presentation can be nice, short, and sweet, as I do want to entertain all of your questions as we can. So welcome again. A couple of things about us. I think overall, one of the big things is we really envy and want to understand everyone's passion and their expertise when it comes to the PM&R field. Our program has a long history being at VCU, and this has really allowed us to create, unique PM&R physicians that able come through our program and honestly do anything they want. So our program has, set up this formal mentorship program, teamwork approach, kind of where we are able to, get people into the fields that they want within PM&R. As we know, it's continually expanding and changing, and fellowships are, changing all over. So we're trying to, make sure that we understand that when all of our people come into our program and work here, we have great research leadership. Obviously, a large academic center in a right-sized city. Richmond is great. Like I was saying before, our PM&R program has been here for a very long time, so we have a good relationship within the community and within VCU itself that allows us to kind of thrive and be able to get so many opportunities for learning and research here. I think kind of going back to finding your passion and creating your expertise, we have Dave Sifu, who writes the Bradham textbook. He's the editor, who has created this expansive alumni network that also allows us to kind of, go and meet with people and find jobs and really get into places that we want to be in. Here's our mission, to educate, develop highly competent, compassion-driven PM&R docs. We stand and hold true to that, as you'll kind of see through this presentation. As far as our rotation curriculum, it is balanced inpatient and outpatient. Obviously, as PGY2s, it's a little bit heavier on the inpatient side. All of our buildings are essentially state-of-the-art. We have a brand new acute outpatient pavilion that we just opened and work on the 13th floor. It's amazing. Our inpatient rehabilitation facility was new when I was a PGY2, so it's only a few years old. We also rotate at the VA, downtown Richmond Medical Center, and then we also have a short pump location. So we are a little bit spread out, but that's not uncommon for PM&R programs. But all of our places are wonderful, great facilities. Another thing to touch on is the engagement and leadership opportunities throughout residency. So as 2s, 3s, and 4s, we can get leadership positions within different facility sites or QI research, et cetera. So you have those opportunities, which is really nice. Again, finding your passion, expanding your expertise. So if you're, really involved in researching QI, there's a track that you can become, a leadership position in that. I was more involved in administration. So I was the Sheltering Arms Institute, which is our inpatient rehab hospital. I was like the clinical site leader for that. So that allowed me to kind of expand my leadership opportunities. So if you want to chat more about that, we can talk about that. And I guess finally here, experienced faculty within department in a large academic center. Yes, so we've been here for a long time. We're very experienced. We have wonderful faculty, and You can see all that on our website. Facts and figures, we are a 3-year program. However, we do have PGY1 spots that are available through different code in the match. If you get the opportunity interviewed here, you will learn about that process. We have a greater than 95% board pass rate. First take, ding, 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 first take for our graduates. And it's great. Most of them, I think within the past 5 years, these figures are coming from, are within the highest quartile, and 2/3 of them are above the average. We have just honestly every fellowship, so that is just great to kind of have within our program. So you get exposure to working with fellows, being side by side with them, and also having the opportunity to interview at places like these if you're considering staying. So we have a musculoskeletal amputee, which is non-ACGME. Then we have pain, spinal cord sports, and then TBI, which are all ACGME. Strong national alumni connections, like I was talking about before. We've been here for a very long time. So we've obviously produced physicians that have gone to work all over the country, and that gives us a lot of access to research grants if we want them through those alumni connections. We've had past presidents in basically every national society that there is that exists. So that's just another thing about our program. And then like I was talking about before, Dave Sifu is really a huge, huge name in the field and has some of the biggest grants that our health system actually offers right now. And then he's also the editor for Adams. So teamwork, family collaboration, community. So mentorship, we are paired with a faculty member as soon as we enter the program to kind of allow us to work on that expertise and our passion and figure out what we want to do in the field of PM&R. We have formal research in QI, coverage at all sports levels. So we do high school, Division I through VCU, through William & Mary, through Longwood, through University of Richmond. We also work with Sportable, which is a local kind of nonprofit organization that works with patients with disabilities in sporting events, which is awesome. We have a competitive benefits, vacation, and salary. Again, all of this is on our website. Many educational resources, innovative learning, like I was talking about through our research and other things that we do here. We also get money for educational expenses, and then we get coverage for travel to conferences, particularly if we are presenting at them. Additional details available on our website. So just briefly, our call, we do a 24-hour call kind of in person at Sheltering Arms, which you stay in-house, heavier as a PGY2 and then decreases through subsequent years as a PGY3 and 4. We do home call for our VA, which are week-long stints. And again, call decreases each year as you go through for 3s and 4s. We do have to have 2 adaptive sport coverages per year. Research curriculum. So we have a journal club that's once a month on every Tuesday. We do research through CERSI. Again, faculty mentor, education allowance on top of our mentorship. So you get further travel support if you want to do things that you're kind of doing while working through a formal mentor. And then our resident faculty events, I mean, there are tons, but some of the little things we've done recently are mentor-mentee outings. Recently, we did something for our nonprofit where we did a happy hour and we all went to that. We have a women in leadership event series kind of that they all work through and some of our physicians belong to, which is awesome. We also have a diversity and inclusive practices work group, resident family against. We do a faculty challenge, which is awesome every year. So I think with all that said, I mean, come join us. We have an awesome city, awesome outdoors. We're close to Shenandoah Mountains. We're close to the beach. Food here is great. Cost of living is good. Our faculty is diverse. They are experienced. We have an amazing leader, amazing research, amazing fellowships. All the schools around here are awesome. For those of you that may have families, it's affordable. A lot of our residents come and buy houses and stay. So that's just another perk of coming to this program. And then I think kind of the caveat off that is that our program is very accepting of that. We understand kind of people who have families and time constraints, et cetera, et cetera. So our program director is awesome when it comes down to that. Again, look at our website. Everything is on there. If you have questions, you can email me. I'm sure George will follow up and send my email out, and I will take time for questions. Yeah, so just elaborating a little more on the leadership opportunities. So, like I was saying, when I was the inpatient sheltering arms clinical lead, what my role was meeting with the CMO every month on a formal meeting, determining things within the organization that need to be improved, things from a resident level that need to be improved, et cetera, et cetera. We do not do a formal community outreach lead, but we have someone who does a sports lead. So they coordinate all of our sports coverage opportunities, our sportable opportunities, et cetera, et cetera. Sabrina, do you want to talk about your role this year? So one of our PGY3, Sabrina's here too.
Hi, I'm Sabrina. Nice to meet you guys. So third year, or when you're a third year resident, you are designated kind of a leadership role, which is good. It gives you kind of some experience, like some administrative things. Like for instance, I'm the community engagement lead, or like the social chair, so to speak. So I get to plan like a lot of the social events to kind of like, bring us closer together as residents. Planning like mentor and mentee outings, and also I'll be helping with the kind of interviewing and process for reaching out to people that are interested in joining our program. So that's my role. And then there's also like somebody that runs like one of my co-residents like is in charge of like the research, like journal club, kind of setting that up. And then another one of my co-residents like assigned like the kind of the lead over at the VA hospital, and helping with our ultrasound like hands-on curriculum. So it's good. There's a lot of different, and then those are all things that you can put on your CV, and that kind of gets you like getting to you to do things that are kind of outside of the role of what you would typically expect as a resident. And it's good experience. I'm trying to set all of those things up.
Yeah, I did like promotion and tenure committee, which was really nice to see, because I had an interest in academic medicine. So it kind of gives you an idea of hierarchical stuff, because you don't see that, as a resident. And it's important to know when you turn into an attending. That's important to be promoted and have tenure. So it's good to see that process. So we have opportunities in that as well. Someone's asking about couples matching. I don't know if anyone specifically in our program right now has couples matched.
So in my class,
You
we
may.
have Jonathan.
Oh
One of
yeah,
one of my co-residents,
Yeah.
he couples matched with his wife, who's radiology.
radiology. Yeah, they did
Yeah.
couples match. So yeah, that's not uncommon for us, and we're open to that for sure.
I don't have experience with it though.
Yeah, I don't either, but I know from doing like interview season last year, like we're very open to that. It's not an issue. Does your program support IMGs? Yes. We have a formal ultrasound curriculum, just so everyone is aware of that. I didn't mention it in the presentation. So we use the ESSR guidelines, which is like the European Society for Radiological Medicine. So we do that throughout the year. It's awesome. Some of our best ultrasound attendings come and teach it. It's multiple times a year. We do each joint throughout the course of the year, and we repeat it every year. So that's awesome for you to get involved in. What do you find to be a unique part of your program?
I can say that what I think is really unique about this program is what kind of what Chris went over before, that this is a well-established program. We've been around for a while. We have a lot of connections in the small world of PM&R, and a lot of influential names. I like that we have so many fellowships. As somebody that personally isn't interested in doing a fellowship and um, is looking to do more like general, like anything inpatient or outpatient. I also feel like this program's like really well rounded and will just because we have so many fellowships doesn't mean that, in fact, like I think Dr. Sifu doesn't like fellowships in general. Like, I mean, obviously, like we
Yeah, so
he says if
basically
yeah.
our program chair like thinks that we are educated, well-rounded enough to go out and practice in all of those areas because our not our I mean our procedure numbers are so high, our ultrasound numbers are so high, our EMG numbers are so high that we don't need to do that formal fellowship training. I mean, we get enough sports coverage to be comfortable to go do those things just coming out of the program. So I think we're unique in that regard, that we're so well-rounded, but we also have all those opportunities for fellowship, but may or may not be needed essentially. And we have an amazing VA, like amazing. So that is also unique about our program. We get some really good training over there. I think one of the fours last year had like upwards of 250 peripheral joint injections. We get 250 plus EMGs. I don't know how many axial procedures. I've done a lot of fluoroscopic. So all of that is there. There's opportunities for all of that.
Yeah, I didn't realize how valuable it would be to like be connected to a VA because I know a lot of PM&R programs, seem to be fine without it. But like you just get exposed to I've injected PRP and people.
Yeah,
I've done like nerve blocks, like genicular nerve blocks under ultrasound as like a second year resident.
yeah.
Doing most of it, and then the attending's there. Like you're not stuck in the room with the patient alone. The attending's
Yeah,
there to
we do
guide you.
PRP, geniculars under ultrasound as twos, and then you do
Yeah.
them under fluoro as a three. Yeah. I don't see any other questions. Any other questions? Oh, and if you want to do away rotations, we accept rotating medical students too. Which I know is important to all of you. And we're very open to that, like having AIs and away students. So we can help with all of that. We can help with figuring out places to stay if you do rotate here. We have great coordinators and leadership. Yeah, we only do VS. Yeah, we only use that service, but if you email or on top of it and don't hear back from us from VSLO, I think you can work out other ways to get over here to rotate with us. Just so you're aware, Steve.
Yeah, and I've worked with a lot of the rotating students, and when you're on inpatient, like you definitely work really closely, and actually, like it's been super helpful having a med student sometimes, and you get to know each other, and you get a taste of what the culture is like,
Yeah, that's a
especially in
great
the
point.
inpatient
Yeah.
hospital.
Yeah, good teaching opportunities. So we get to have the med students as twos and threes on TBI. So that's nice. Yeah, if you talk to Haley Matthews, Haley, I'll just type her name in. Matthews or Sharon Mann. They, I think, are both on our website. and they'll be able to kind of give you all that information about doing a away rotation with us. Awesome. I think our time is up. Thank you, everyone. Thanks, George.
Thank you, guys.
Thanks, Chris and Sabrina. Appreciate your time. Good to see you again.
You too.
Good to see you too.